Hello and welcome to MD Newsline. Thank you so much for being here. Please introduce yourself to our audience.
Of course. Thank you for having me today. My name is Peixuan Zheng. I'm a researcher from University of Illinois Chicago, UIC. I'm very honored to be here. I've attended CMSC for a couple of years. We kind of presented our oral presentation focusing on rehabilitation side. I'm actually an exercise scientist focusing on MS. We use exercise training and physical activity as a behavioral approach for promoting MS symptoms and for disease management.
So you presented some really interesting work here at the conference. Please tell me a little bit about that.
Of course. I presented our recent work on psychometric properties of step-based physical activity metrics, including daily steps and peak cadence in people with multiple sclerosis. The purpose of the work is to focusing on a measure that can capture real-world walking performance. We know that clinical measures of walking for people with MS, including some performance-based tests, including time 25 walk, 6-minute walk, those are typically measured or conducted in a clinical, well-controlled environment. They may not really capture the real-world performance, such as in a complex environment that requires a lot of motor cognitive challenges, especially for people with functional declines or chronic conditions such as MS. So the work we're doing is trying to figure out a new system. It's called step-based metrics, measured by accelerometer or wearable sensors to capture more of their natural ambulatory behavior in their real life. So the metrics we're doing is including daily steps, which a lot of people are familiar with, to capture amount of physical activity a person did across their day or a week. And then the new metric, what's very fascinating about is peak cadence, which is the highest value of their cadence or how many steps per minute they walk in a short time of period. So there are two metrics. The first one is called peak 30-minute cadence. That is the highest 30-minute cadence value a person accumulated the walking across the day, and the measurement period we have is 7 days. So we collected those 7 days peak cadence value across all the monitored time, so it best reflects a person's natural best effort during their walking activity. So it's also shaped by intensity of their walking as well as persistence they did for their ambulatory behavior. Whereas peak 1 minute cadence is very simply highest cadence value across the day. That is more relevant to their physical capacity, how fast they can actually move in a single minute, and as well as their willingness to perform such ambulatory behavior, especially at the higher intensity. Yeah, so we validate our work. First of all, we focus on its relevance to walking outcomes that's assessed in a lab space. We performed correlation coefficients. We found it's highly correlated with walking outcomes performed in the lab, and as well as gait parameters assessed by those gait right, walk away system, including gait velocity, step length, and step time. We also did reliability metrics, including measurement these outcomes at two different time points, 6 months apart without intervention. It's very fascinating about this is we choose a time frame of 6 months because it's consistent with all the clinical monitoring of MS, as well as those intervention trials, which is typically 4 to 6 months. Yeah, so we measured these outcomes at two different time points. We found it's highly reliable and then very stable without change, even considering those natural environment, external factors, environment, changes across time. We didn't observe significant changes, which means they're quite stable and consistent outcome that reflects their walking performance over 6 months. Yeah, that's pretty much it. And for the constructive validity, we published work before. It reflects the real world walking. And then now this novel finding here in this study we presented is about their reliability. It's consistent over time. So we think now it's ready for using these step-based metrics in clinical trial and practice to represent walking performance in the real world, which is more relevant to people with MS, right?
Mhm.